Welcome. If you're watching this video, you're having a total hip replacement at Mercy Medical Center. I'm Ryan. I'm one of the physical therapists that works here that will see you day of surgery. Yes, I said day of surgery. So today, the goals are to talk about a few different things. One, talk about preparation or what to do before the surgery. Two, expectations for during your hospital stay with physical therapy. And then three, your discharge plan of when we get to go home. So first, like I said, we'll talk about preparation before the surgery. Number one thing we'll talk about is, A, go to your PACE appointment. At that PACE appointment, they'll talk to you a little bit about expectations leaving the surgery, but also they'll give you this joint book. This joint book is very important for physical therapy components, whereas my job in the hospital, I deal with your mobility. So that's getting in and out of bed, standing, walking, stairs if you have to do stairs, and your exercises for your legs. So within this joint book, it contains those things I just mentioned. I'll show you. First off, the most important tab will be this Going Home tab. From our standpoint, this is going to tell you, A, how we're walking with a walker, which I'll talk about later. B, how you're getting in and out of chairs with using this walker. And then finally, how we're going to be doing stairs with either the walker or the cane, depending on how your house is set up. We do recommend, if you have more than 2 steps, to try to have rails installed, at least on one side, to get in and out of your house. It will make the transfer a lot easier. The next page that's important for us is this green tab here, talking about the total hip exercises that you'll be completing while you're in the hospital. We do recommend that you try these exercises before you come to the hospital, but let pain be your guide. Obviously, if you're having the surgery, you're probably having some pain. So by doing these exercises, if it causes too much pain and doesn't allow you to be functional throughout your day, we can cut back. The biggest thing is to kind of get exposure to these exercises before you come. So there's exercises here on 2 separate pages, a front and a back, to make 7 exercises total. And it also describes how we'll be getting in and out of your bed while you're here at the hospital and then at home. So again, you'll get this book at your PACE appointment. Also at your PACE appointment, you'll get a sheet that talks about your home environment. Please try to fill this sheet out before you come. It's very important for us to kind of see a setup of your house so we can plan for discharge for hopefully going home. So that's the first step. Go to your PACE appointment and get your joint book. Second thing I'll talk about is the walker that's here in front of me. We would like you to try to get a walker before you come to the hospital. The walkers that we would like you to bring are the walkers that have no wheels on them. As you can see here, there's 4 posts without wheels. This is called a standard walker. If you're able to acquire this before you come to the hospital, that'd be great. And the way to size it, I'm going to turn the walker here and show you. I want you to stand into the frame of the walker. You're going to put your arms straight down at your side. I want the grip here to hit yourself in the wrist. That means a good size for me because when I'm moving, I want my elbows slightly bent to help make the transfer or the walking easier. So that's the second thing I'd like you to do. Try to find a walker if you can. If you're not able to, we can kind of discuss that while you're here, but it would be important to kind of bring it with you too so we can make sure it's sized appropriate to you while you're in the hospital. So that's the second thing. The third thing is kind of game planning with your house. The biggest things after this type of surgery is you're going to have precautions. So one precaution is going to be not bending too far when you're sitting in chairs. So the imperative with that is we don't want you sitting in low seats. So that usually means recliners are out for the time being. They're too low, they're hard to get out of, and they're also going to break these precautions that I'll talk about later. So we recommend trying to find a chair in your house that has a nice firm bottom, usually about 20 to 21 inches off of the ground. If you're shorter than about 5'5", usually any surface will be okay. But if you're taller than 5'5", try to get a chair that's between 20 to 21 inches tall at least. As mentioned before, with your house setup, try to, if you have more than 2 steps, to get a rail installed on that house. It'll make it a lot easier for when you leave the hospital and kind of game plan for when you go home. We also will practice the stairs while you're here, so you'll have exposure to that while you're in the therapy within the hospital. All right. So those are kind of the main things I want to touch on before you come to the hospital. Other than that, the last thing would be the discharge plan. Patients leaving the hospital here potentially will have 3 options in regards to therapy. They'll have therapy come to your house. You can have physical therapy where you go to a clinic. Or finally, you can have physical therapy where you go to a skilled nursing facility. Not all total hip replacements leave the hospital with physical therapy services. Some go home without any and just to practice your exercises and you're walking individually or with your care partner, which we'll talk about later. Otherwise, you do have those 3 options, and we can discuss that while you're here in the hospital, and we have a social worker on the floor at all times that can explain these options further with you in regards with your insurance. So those are the kind of things I want you to think about mindset-wise before you come to the hospital. Now let's talk about day of surgery. So everyone's surgery will be at different times throughout the day, but the goal is, from a physical therapy standpoint, is we're going to try to see you the day of your surgery, one time. The other therapies that you'll see in the hospital is occupational therapy, which my colleague Amy will talk later. They deal with activities of daily living, like bathing, dressing, and toileting. They won't see you that first day. They'll see you the following day. So like I said, expectation is physical therapy is going to see you that day of surgery. So for this video, let's have an example of you're having surgery on a Monday. You come in on a Monday, you have the surgery, you're in recovery, then you come to our floor here, which is the 3rd floor at Mercy Medical Center. On the 3rd floor, I will see that you have arrived in your room. I start off by giving you about an hour window. That allows for the nursing staff to do their vitals checks and get you settled in. And then I'm going to start calling the nurse to see how you're doing and see if you're ready to start therapy. The goals for therapy that day are more of an education day, kind of get to know you, your housing setup, teach you those exercises that I talked about in that joint book, and then potentially getting you out of bed. Whether it be just sitting on the edge of the bed, potentially standing, and even walking. Most surgeries will be what's called weight bearing as tolerated after your surgery. So what that means is, with your surgical leg, let's say for this, my right leg is my surgical leg, or my surgical hip. When I'm walking or standing, I can put as much weight as I want on that right leg. You're not going to hurt it by putting weight on it. And the same caveat, it may hurt. We do expect you to have pain. We have great nursing staff that will take care of you as far as your pain medication is concerned, but we also have plenty of ice packs here that will help. But yes, you can put as much weight as you want on that leg. So like I said, you had surgery on a Monday. You see physical therapy, myself. For one visit, I get you tucked back into bed, I get ice packs on that right hip, you get a rest for that evening, and we'll discuss more kind of the plan for that evening. Otherwise, we won't come back till then that following morning, that Tuesday morning. Physical therapy, myself, and the occupational therapist, Amy, who will talk next, will see you that morning, and then potentially that afternoon. That morning session, again, is similar. We're going to work on the exercises that we worked on the night before. We're going to try to walk again, hit a restroom, and also potentially talk about what's called our care partner training. This is something I'll try to establish that first day I see you. What that care partner training is where we involve family and friends in a treatment session. Usually it's that Tuesday afternoon treatment session where we're going to go through the exercises with you and your family or friends, the walk-in, and that's when we're going to try those steps. Because we got to make sure we get in your house. We can't sleep in your car. So think about that now before you come into the hospital of who a care partner may be that may be able to help you not only in the hospital, but then when you go home too. We want to make sure there's good carryover, because we're going to teach you a lot of stuff while you're here. Again, like I mentioned, if you do forget anything, though, the education that we went over with the physical therapy and the occupational therapy is contained within this book. This is kind of your encyclopedia. So if you have questions, look in here, but also we'll give you our phone number that you can call us when you leave the hospital if you have any further questions that you forgot to ask. All right, so that Tuesday morning, Tuesday afternoon, we do both physical therapy sessions. You're moving great. We think we're ready to go home. So we're having this discussion with you throughout the therapy process, that you're progressing well, that you're getting out of bed with either your care partner or by yourself. You're able to stand with either your care partner or by yourself and walk a decent distance and try those steps. If you meet those goals from our standpoint, we determine that you're ready to be discharged to go home. Again, this shouldn't be a surprise to you. We've been talking to you through the process of how you're progressing toward those goals and then what day or time we expect you to discharge. Anticipate leaving that Tuesday afternoon. Again, we'll have a discussion with you about this, but anticipate leaving Tuesday afternoon, and then in turn, following up with maybe some physical therapy if we deem it's appropriate and you agree that you think it's a necessity with going home. All right, so that's kind of the plan of why you're in the hospital, and now I'm going to show you some things of what we're going to do actually functional, moving around. So we'll start off in the chair over here, and I'll work our way up into walking, and then I'll show you some steps. So, like I said for this demonstration, my right leg is my total hip replacement. I'm going to teach you a specific way of why I want you to get out of the chairs, because you're going to have these precautions while you're here, and these are deemed by your physician, and you can follow up with your physician when he or she deems it appropriate that you don't have to follow these precautions anymore. So there's 3 total hip precautions. Number 1 is do not bend past 90 degrees. As the picture shows, and we'll go over this when you're in the hospital, we don't want you bending over more than 90 degrees, or also not sitting to where your knees are higher than your hips or bending more than 90 degrees. The second one is we do not want you to cross your legs. Some physicians will have you come back to the floor with a pillow between your legs or an immobilizer. You will notice this when you get back to the floor, to our 3rd floor here, and usually that's a recommendation when you go home. So like I said, the second one, do not cross your legs. And then the third, we don't want you twisting. Twisting is kind of a twofold thing. One is why I mentioned before in the joint book, I'm going to teach you how to get in and out of bed, because usually the tendency is you want to twist to get out of bed, but also when you're moving. We're going to move kind of robotic type movements. So you're not turning your body to turn to the right. It's more of a march in place. And again, I'll talk about that here in a second. So the easiest way to remember these precautions is BLT, like the sandwich. We've underlined those letters there. So B stands for bending, L stands for legs, and T stands for twisting. Again, we're going to remind you of these when you're in the hospital, and we'll also hang this on your wall in the hospital room, and we would like you to take these home as a reminder too. Again, you can follow up with your physician when you no longer have to follow these precautions. So like I said, I'll start in the chair and work our way up, and we'll go from there. All right, so like I said, my right hip is the hip I had surgery on. As you can see here, we do recommend chairs that have arms on them. It's going to make the transfer from sitting to standing a lot easier. So when I go to stand, the first thing I would like to do is I'm going to put my right leg, my surgical leg, out in front. I'm going to sneak out towards the edge of the chair, make that a little bit easier for me. I'm going to place one hand on the walker, and the other hand is going to push off from the chair. This is usually just a position of comfort as far as which hand that you choose. Usually I recommend the opposite hand to be on the chair from your surgical leg. So when we go to stand, I push through the arm of the chair, through the walker. We come up into standing and bring your surgical leg back so your feet are even. Now we're going to take some forward steps. So I'll turn so you can see me here. As mentioned before, your weight bearing as tolerated. So I can put as much weight as I want on this leg. If that's changed, your therapist, when they come and see you, will let you know when you come to the hospital. We're going to move the walker first. The walker goes ahead if you like this, so the back posts of the walker are lined up with my toes. The second part of this is I'm going to move my surgical leg, my right leg, into the frame of the walker. The biggest thing with this is your step length. I took a step just into the middle, not way out in front, or not just a small step. The reason for that is you want to maintain the stability of the walker and keep you balanced. So I take a step with my right, my surgical leg, catch up with my left, just like that. So it's slow but efficient. Walker, surgical, good. Walker, surgical, good. Again, as mentioned, we will have sized the walker for you so it's an appropriate height. So if you do bring a walker with you to the hospital, please bring it to your room at least some point through your hospital stay so we can make sure it's the appropriate walker, A, but also the appropriate height. All right, so that's how we'll be walking. The last part is your step setup, or your stairs at home. So for this demonstration, we'll show you 2 different types of stairs. One, if it's a platform step, where it's a nice wide step where you can put the walker completely on top. But also, if it's a regular size step, more of a narrow width, where we'd have to potentially either put the walker sideways, or we can use a cane. If you have a cane, just let us know. You don't have to bring it to the hospital. We will have one here we can practice with on the stairs to see if that's something you would like to go home with. All right. For this demonstration first, I'll show you if we just have a standard platform step. So again, my right leg is my surgical leg. I'm going to come nice and close to the step here. I have enough room to put the entire walker on the step. I'm going to go up with my good leg, my non-surgical. Up with the good, follow with the surgical. So the saying is up with the good, down with the bad. Or you can fill in the blank there. All right. So now I'm up onto this step. Now how do I get down? As mentioned, I go down with the bad. And so I'm putting the walker down first, then my surgical, my bad, followed by my good. So that's showing if you have a step that you can put the walker entirely on. Otherwise, if it's a narrower step or just a regular size step, we can put the walker either sideways or use a cane. And this is why sometimes using a rail is important on the opposite side, so you have a little more security when you're negotiating these steps. So again, for this demonstration, my right leg is my surgery leg. I put the walker sideways like this. So the walker's on the step that I'm on the ground floor, and the step I'm going to, up ahead. I get close to the step, I'm going up with my good, my non-surgical. Follow with my surgical. And then we move the walker up to the next step, and then again, same, follow with that sequence. Up with my good, my left, follow with my surgical. Again, you can see it'd be nice if I had a rail here because this hand just kind of hanging out, and just for stability and just for overall confidence, nice to have a second hand assist there. Now if I'm going down the steps, we'll go down this way. So again, as mentioned before, I thought I'd get back to this. We don't want to twist. So if I'm here on the step and I'm trying to go that way, it's small pivots to move, more robotic movements. We get to the edge. Now how do I get positioned here? I put the walker again on the step that I'm on, the step that I'm going to. I'm going down with my bad, my surgical leg. So down with my right, catch up with my good or my left. And then again, each consecutive step, the same sequence. I know I've taught you a lot today, but the biggest thing is you're going to get physical therapy while you're in the hospital. We're going to have plenty of time to ask questions, and we'll review this stuff multiple times. And again, as mentioned, it's all in that book that we're going to give you from PACE. So if any questions or concerns, don't hesitate, read through here, but also give us a phone call. We're here 7 days a week and happy to assist with any questions that you may have. So good luck and hope to see you soon. Thanks.
Hello and welcome to the occupational therapy portion of joint class. My name is Amy. I'm one of the occupational therapists here at Mercy Hospital. If you're unfamiliar with occupational therapy, we work on your self-cares, how to get dressed, how to bathe, groom, go to the bathroom, all of the typical self-cares that you do every day. I show you how to do these things safely. After a hip replacement, you do have those hip precautions, which Ryan mentioned previously, and they include no bending past 90 degrees, no twisting, and no crossing your legs. And so some of your self-cares can become very difficult to complete as you did before. So I can teach you how to do them using new equipment, and I can also teach a care partner how to help you with them safely. So typically, OT will come and see you the morning after your surgery, and we would like you to have a care partner present that afternoon. So if you have surgery on a Monday, we would like you to have a care partner, whether it's a family member or neighbor or friend, come in the afternoon the following day so we can show them how to help you and how to do things that they're going to need to do for you after surgery. I'm going to go over some equipment that we have. I do like to make sure that you know right off the bat, insurance does not typically cover any of this equipment. It is considered an out-of-pocket expense. But the good news is not everyone needs all of these pieces of equipment. I simply go over them so you know what's available should you need it. First thing we're going to talk about are your TED hose. Some of you may be familiar with these from prior surgeries. They're worn to prevent blood clots, so they're very important. The doctors typically ask that you wear them about 4 to 6 weeks, at least until your post-op appointment with them after surgery. They come in a thigh high, which is like this, or they also come in a knee high, which is about this long. Your surgeon will determine which TED hose he prefers you to wear. You typically wear them 23 out of 24 hours of the day, so they're off for 1 hour a day. Most people do their bathing in that time. And we also will give you one pair when you come here. Insurance will cover that pair. If you wish to purchase a second pair, you're certainly welcome to. Just let your nurse know while you're here, and they add it onto the hospital bill before you leave. Typically, they run $12 to $16, maybe $18, depending on the length and the size that you go with. We also typically have you wear them, I think I mentioned 3 to 6 weeks, but your doctor determines exactly how long. If you have trouble getting those TED hose on and off, we have what are called sock aids. You may be familiar with these from friends of yours or if you've used them before. You'll notice we have 2 different sizes. This is a regular and this is a wide square. Men typically end up using the wide square. Their foot is a little bigger, so they need a little more room. So if you're home by yourself and you need to get socks or TED hose on, this is a safe way to do so without breaking your 90-degree hip precaution. So all you do is put this onto the sock aid like so. I like to turn it on its side. It gives me a little better grip. You pull it all the way to the end. You leave a little pocket for the toes at the top. And you'll notice there's a nice opening at the end here for your foot. And then you're going to go fishing. You're going to cast out and throw this onto the floor. Then you'll slip your foot inside. So what ends up happening, if my foot is just kind of like my hand, pulls it on just like so. Now, of course, some days it will go more smoothly than others. You kind of have to get your own technique and practice, and it will get easier. Another option, of course, is using your care partner. We show them using a plastic bag how to get the bag over the toes and then thread the sock on over it. The bag eliminates the friction, making it much easier to slide onto your foot. These have a hole at the bottom, and we pull the bag out of the bottom. Works pretty simply. Next thing we'll talk about is how to get those TED hose off. Again, with those hip precautions, you cannot bend down and slide past your foot. So if you have this, which is called a dressing stick, you take this prong pointing down, and you're going to push it down and past your heel like so. Okay? Most are familiar with a shoehorn. This is a long, an extended version of one. It's metal. They also come in plastic, so they're a little less expensive. But most people know what to do with a shoehorn. Stick it down into your shoe and slide your heel down. Makes it much easier so you don't have to bend and put your thumb back there. The most frequently recommended item that I give to my patients is this. It's called a reacher. Some people call it a grabber, as it's most notably known for picking things up off the floor. This eliminates you having to bend down, makes it safer for you so you don't fall. What a lot of people don't realize is you can use it to get dressed. If we find that when you try to put your underwear and your pants on past your feet, if you bend too far, we may recommend that you use this. You grab your clothing at the waist, slide your surgical leg in first. Always start with the sore one. Then you come back and put the good one through. Reach down and pull them up to your waist. We, of course, would want you sitting when you're putting them past your feet, and then you stand up and pull them up to your waist. One of the last smaller pieces of equipment I go over is a toileting aid. Now, typically, the most common time we're going to reach and twist is when we're reaching in back to wipe. So part of an OT's job is to make sure that you don't twist when you're completing your self-cares. So we have what are called toilet tongs. This is the most common model that we recommend to our patients. You'll notice they have a rubber coating on the end. This eliminates any metal from reaching your sensitive skin back there. They also have an angle, so it helps you to get back there a little easier. Wrap toilet paper around, reach back to wipe, and drop it into the toilet. Pretty simple. This takes a little practice, a little getting used to, and this is, again, not something everyone needs, so we work with you on an individual basis to help you determine if this is something you would benefit from. So all of the equipment, as I mentioned, insurance does not cover. There are many places that you can get it. CarePro is a very common one. You can also find them online if you're good with a computer. And even some of the smaller things, they may have it like a CVS or a Walgreens. You can just check around and see if they have them. Otherwise, we can help you here in the hospital. We can help you get them as well. There are also things like walker trays, walker bags, baskets, all sorts of things that you can attach onto the front of your walker to help you carry things. We never want you carrying an item in your hand when you're using the walker, because it can end up with your hand slipping off and you falling. So there's all sorts of attachments you can get. Trays especially are helpful for in the kitchen, because if you have to carry your plate of food from where you're making it to where you're going to sit to eat, and if you don't have a countertop to slide it along, we'd rather have you put it on a tray to be safe. So that's most of the smaller equipment. We'll kind of segue now into your bathroom setup. If you have a walk-in shower, we usually recommend going in facing front. So if you have your walker, and most showers have a small lip to step over. So if we imagine that there's that small lip of your shower right in front of me, If the walker fits into the shower, we have you get your toes right up close to it. Walker goes up and in first, and then the surgical leg steps over, and then the good leg. This allows me to push through my arms so I can eliminate the weight on the sore leg when I'm stepping over. Now some of you may say, but my walker, it doesn't fit into my shower, it's too small. In that case, what we do is we have you back in. So if you imagine that the edge of the lip of the shower is right behind me, my heels are against it, I'm going to push through my walker, and this time I'm going to start with the good leg, the strong one. So good leg goes over first, then the sore leg follows, and I'm in. The walker is staying outside since it doesn't fit. And at this point, once you're in the shower, we recommend sitting onto a shower chair. This is your most basic version of a shower chair. They come with or without a backrest. Typically, I recommend no backrest unless you need it for some trunk support. If you get tired, if your stomach kind of starts to feel like you need that support, of course we want you to have it. Otherwise, it tends to get in the way. So you have that in your shower, you'd sit, and then you'd shower, get all cleaned up, stand up, dry off, and step out. Now, some of you may have a tub shower. In that case, what we do is we put this inside the tub, and if you imagine the edge of the tub is right back here. I'll grab my walker. So you'll come up to it, and you're going to turn around. You're going to back your legs up so they're right up against the edge of the tub. Now for this transfer especially, I want you to have a care partner present, someone who's there for your safety. So you'll back up to it. They will make sure that you're lined up where you need to be. You reach back and you sit. So your rear end is inside the tub, but your feet are outside. At this point, you turn and lift one leg in and then the other. The reason I don't like the backrest is it can prevent you from leaning back. And we want to make sure that you don't bend past 90 degrees. So when you're lifting your legs over the edge of the tub, we like you to lean back. It gives you a little more room just so that we make sure we stay within those guidelines. So now when you go to stand, if you have a sink or if you have a countertop, if you have the toilet, anything to hold on to, or maybe even a grab bar, which is best, you can use those things to pull yourself up. Some people, they will have enough room, they can push up off the seat, but more often than not, I have people who prefer to pull from the walker to stand. My one rule with this is I don't ever want you to pull from the walker unless someone is holding on to the front, because the walker will tip. So if you have your care partner holding on up there, then I'm okay with you doing one of those. Okay? Otherwise, there's different things we can advise you to install. We will practice this with you while you're here and make sure that you and your care partner are comfortable with what needs to happen. Okay. Now for some people, that transfer is a little too scary and they don't want to risk it. So we have a tub transfer bench. Now this is a pretty sure way to eliminate a risk of falls, but as you can see, it's very, very big. So these two legs go inside the tub and these two legs are outside. All you need to do is come over to this end, you sit onto the seat, and you slide across, lifting one leg over the edge of the tub and then the other. Now for some people, this is not going to fit inside their bathroom. You have to imagine that you're going to have at least 5 to 6 inches of this hanging outside your tub, plus you need room for you and your walker. So you want to make sure that you don't have a sink or a toilet or something in the way that you're not going to be able to sit there before you purchase this. The other concern is the cost. This is significantly more expensive than one of the smaller shower chairs that we just went over. This can range upwards from $100 to $250, just depending on where you get it and how much weight it's certified to hold. Those smaller shower chairs, if they come with or without a backrest, they can range from $50 to $65, just depending on where you get it. Retail stores are going to be a little bit less expensive. The quality may be a little less as well, but for most people they will work. I've seen them at Lowe's, Menards, Target, even Walmart. So those are places you can look. But again, I mentioned CarePro. That's a medical equipment store. It's going to have a very sturdy, high quality piece of equipment that you can be sure is going to work for you. So those are these options. And also, we don't want this surgery to be more of a financial burden than it may already be, so there are lending closets in the area. Grace Episcopal Church and St. Vincent de Paul are two lending closets that you can go to. I recommend calling them, describing what it is that you need, and then if they have that available, they can put it on hold while you drive and get it, or you have a family member pick it up. It's a free will donation. You just give what you can, and then once you're done using it, you bring it back, they sanitize it, and give it to the next person. Problem is we can never guarantee what they have. It's kind of a first come, first serve basis. The last thing we're going to talk about is the height of your toilet. Typically, the high-rise toilets are best. The lower the surface, the harder it is to get up and off of it, and that goes the same for the toilet. Now, most people have a vanity, or they'll have a grab bar or a windowsill. They'll have something beside their toilet that they can use to push up with. So what I'd like you to do is to go into your bathroom, back up to the toilet, and I want you to kick out the leg that's going to have the surgery. Then I want you to put your hands on whatever you have next to you that's sturdy and lower yourself down. Now, if you can get down without plopping down really hard, then we're good. We're doing okay. If not, if it's a struggle to control your descent, well, then we might need to talk about either increasing the height of the toilet or getting you some armrests that you can grab onto. Now, the same thing for standing up. I want you to keep that leg kicked out, push up on whatever you have next to you, and try to stand. If you're unable to do it, again, we might need to look at getting you something to increase the height. So a common form of equipment that we use is a riser. So these come in different widths, everything from about 2 inches to 6 inches. They come with or without the armrests on here. They just latch onto the toilet, and this gives you an increased height to work with. There's also other options. Here at the hospital, we use a commode. We remove the bucket from underneath. We place the commode over the toilet, and that allows us to increase the height as much as we need, and it also gives us armrests on either side. So that's a good option, but make sure that you have room on either side of your toilet, probably at least 5 inches or so that the bars on the outside can fit through. The other option is a safety frame. Now, this is something that does nothing for the height, but it gives you an armrest on either side, and those metal armrests are connected by a bar which latches onto the back of your toilet. So this will give you something to push up with your arms. And sometimes that's all you need, is just something to reach with for your arms. So again, as I mentioned, this equipment can help you to be more independent. It's not necessary for everyone, but we like you to know what's out there and available. If you're unsure of any of it and you want to talk to us before you get it, that's perfectly fine. Keep in mind with bathing that sponge bathing is very common. A lot of people choose to do that initially. Now, your incision, you're going to need to keep that dry for about 2 weeks, at least until the staples are removed. At that point, you can stop covering it. Now, to cover it, we use what's called Glad Press and Seal. You'll find that at your local grocery store next to the Saran wrap. And then we use paper tape, that white surgical tape. You're going to tape down all 4 edges just to keep that dry. So for 2 weeks. Once the staples are out, you don't need to do that anymore. A lot of what I've mentioned for this session, you can find in your joint class book. You will get this at your PACE appointment. Most of the information is still quite up to date. There may be a couple changes, so if you do have questions about it, if we say something different than what's in the book, just let us know. PT and OT will both be working with you one-on-one to answer any questions and make sure that you're comfortable going home. A few other tips of information. 19 to 21 inches, that's the standard height of a chair that works for most people. So if you're taller or shorter, kind of make those adjustments accordingly. We also like you to sit in a chair that has armrests on either side and nothing that rocks or reclines or rolls, nothing that moves beneath you. We don't like recliners. They can put your hip in a compromised position. So we do ask that while you're following these hip precautions, which are usually pretty strict for at least 3 months, after that, it's up to the discretion of your surgeon. We just ask that you don't sit on anything that's going to result in your knees being higher than your hips, because that will break that 90-degree precaution. Other than that, I believe that's all I need to go over with you today. Any questions that you have, please write them down. We're happy to answer them when you come in. Thank you, and have a good day.
Good morning. I am Gretchen Ulmer, and I am one of the nurses here at Mercy Medical Center. I work on the orthopedic and neuro floor where you will be coming after your surgery. So today I'm going to talk about total joints replacement, the hip and the knee, and just the nursing part about that. So when you come to the hospital, you will be parking on the second floor, the south side of the parking ramp. When you go in, they will ask for a photo ID, and they will get you all signed in. They will bring you back to the room to just get your gown on to start an IV, and then you will meet with the surgeon and with the anesthesiologist. At that time, if you have any questions, they will be willing to answer them just to make sure that you feel comfortable with the surgery and the things that they will be doing. If you are having a knee surgery, it will probably take about an hour to an hour and a half, depending on your situation, but that's usually what we say. If it's a hip surgery, it's usually a couple hours, so just kind of plan on that. I always tell families when they come to the waiting room, it's usually pretty cold, so to bring a warm coat. They do have blankets there if you are needing one while you wait for the surgery to be completed. When the surgery is done, the patient that has had the surgery will go to what we call PACU, which is just a recovery area. We will look at the vital signs, make sure you're doing okay breathing, your blood pressure's okay, your heart rate's doing okay. We look at your pain. And then after you are stabilized and you're ready to come to the floor, you'll come up to the third floor with where I work. Your family will be brought by a volunteer, and they will be shown into the room and made comfortable. We have a program at Mercy Hospital called the Care Partner Program, and this is a brochure, this is a little form that we have, and it just tells you that as a care partner, we want to make sure that we are taking good care of you too, because studies have showed that if we are caring for the patient's family member or friends, that the patient is much more at comfort level and is willing to work with the families and the staff to do what is needed so that they can get better quickly. So we want to make sure for the care partner that we are taking care of you, so just please communicate any needs that you may have. Another thing that a lot of people have questions about is regarding pain. So we want to make sure that when you come on our floor, that even though we're still looking at your vital signs, making sure that your blood pressure is doing well, your heart rate, that sort of thing, we also want to make sure that you know we are going to be watching how your pain level is. So we have in every room, it's not this big, but we have a scale that we ask quite often what you're rating your pain at. And this is what we want you to look at. 0's no pain, 10 is the worst, and that helps us kind of get an idea of where you're at. But let's say that your blood pressure is, you give me a pain rating of 2, but when I take your blood pressure, it's way up high. So even though you tell me it's a 2, if I'm seeing that your heart rate's up and your blood pressure is up, we're going to treat it that you have probably more pain than what you're stating. With the doctors, all the doctors are really good at providing different medications for the nurses to utilize for your pain. So when you come on the floor, we will ask you kind of what you have used in the past at home to relieve your pain, just to give us an idea, a baseline, what we will start at. With any kind of pain medication, we also have in the rooms a purple laminated sheet. It looks like this. We have you rate what you want your goal of pain to be. So this is a 3 up here. So we just want to make sure that you have 3 as like if that's what you're stating to achieve written up there. And then we document what your pain medication is, how much you're getting, and what time you will be receiving it. And we'll talk to you in detail about what your medications are and make sure you are understanding them. Usually your oral pain medication that you take by mouth is given every 4 hours, but we come back and check quite frequently to see how your pain level is. So if we would just give you one pain medication, one pill, and we came back in maybe half an hour, 20 minutes, half an hour later and see how your pain was, if you're still having high amounts of pain, know that we aren't going to wait the 4 hours to give you more pain medication. We're going to go ahead and treat that pain medicine right away to you, just depending on what you're needing. We also provide ice. We want to make sure that with like the knees, that we are putting ice above and below your knee. And we also, for hips, put ice on the surgical site. So that's something that you may want to purchase in advance, are like ice bags. We do have a medical store here at the Mercy Hospital that you can purchase ice bags that are really nice to store in your freezer so you're prepared before your surgical date. And they cost about $7 a piece. So knees, you'd want to purchase 2 ice bags, and hips, you'd want to purchase 1. Another thing when you're on our floor that we're going to be looking at, besides doing our vital signs and looking at your pain, is we're going to make sure that you're doing good with your deep breathing. We want to make sure we prevent any kind of pneumonia issues. So we'll be having you do some really good deep breaths and doing some coughing. We also utilize, and you may be familiar with this, it's called the incentive spirometer. And what you do is you suck through the mouthpiece just like you were sucking through a straw. And then you keep the blue nugget between the 2 arrows. So it would be a nice gradual intake of breath. So this is how you would do it. And then you just relax. We usually ask you to do this 10 times every hour. We won't wake you up in the nighttime unless you get up to go to the bathroom, then we'll have you utilize this. But that's how important this is. And you can bring this home and utilize it too at home. So this is an incentive spirometer. It's very important, like I said before, that your pain is under control so that you can get up and move around, because we want to prevent blood clots. We also use TED hose, which are like white stockings that are pretty secure to your leg. They help just to give security to your blood vessels. And we also use like these little massage things that go around your calves. They're called SCDs, and they just kind of deflate and then they inflate like every 15 seconds. We encourage you to wiggle your toes and wiggle your feet. It's very important just to keep that moving. We check your pulses in your feet. We check your bandage that you come back with after your surgery. Just know that there's going to be a lot of checks that we do. With the dressing that is on, with the knees, you will have your dressing from above the knee to basically to your, almost to your toes. And then that's for knee surgeries. For hip surgeries, you guys will usually just have like a 4x4 on your surgical site, some kind of a dressing, and then some tape around it. Depending on the doctor and their orders, they may have us change that the next day, or it could be a couple days. It just depends on the doctor what they do. But we will read the orders and make sure we do as they have ordered. If you have staples, those are usually removed 2 weeks after you leave the hospital, and it's usually done at the doctor's office. With your diet, you will have, like I said, an IV, and so we will keep the fluids running, but we will give you ice chips initially. We will have you take fluids, Jell-O, those light fluids initially to see how your stomach's doing, and then progress after that. If you're doing well with the Jell-O and you need more soup, something like that, will advance you as we see that you're tolerating it well. Before your surgery, you're not going to want to have anything after midnight. You want to make sure if you do take some pills in the morning that you have been okay to take for your doctor, you can take some sips of water, but otherwise do not take anything by mouth. The supper before your surgery, you can have a nice meal, not a whole bunch of food, but just have a nice meal so that it can kind of sustain you for the next day. And then, like I said, then after your surgery, we'll start out with the clear liquids. When you decided to do your surgery, from that moment until you are discharged, we have been providing education so that you feel that you are going to be as safe as you can be, and have the most information you are needing to feel comfortable with your cares that you are going to be doing along the way. And so talking about discharge planning, when it comes to that time, you will meet with a social worker during your stay at the hospital, and they will visit with you to find out how you're doing with physical therapy and occupational therapy. If you're doing really well and your plan is to go home, then as nurses, we'll prepare those discharge papers and then present those to you and make sure that you're understanding them clearly before you leave the hospital. And usually discharge is about 3 in the afternoon you can plan as like the latest to leave the hospital, just so that you kind of have that idea that it takes that long to work with therapy and have the doctors do the discharge orders, and for us nurses to get the papers ready to present and provide the education to you. But let's say if the social worker works with you and meets with you and you're not ready to go home, maybe you need to go to a skilled facility, maybe you need home health, just know they will be visiting with you and setting that up with you, and just let them know what you're feeling and communicate your concerns and your needs. That's very important for us. Every morning we meet as a group. It's called Care Conference. So you will meet with a care coordinator during your stay. You may meet with a hospitalist. You may meet with our nurse practitioner, the social worker, of course us nurses. So lots of names, but just know you will get to know us, and then we just want your stay to be as pleasant as possible while you're here. Just know that in the booklet that you receive, usually during your PACE appointment, on the back cover there's a card that talks about total joint replacement. You need to put that card within your purse or wallet, and then anytime you have any dental procedure, you just need to make sure that you know what your doctor and the dentist have communicated regarding antibiotics prior to any cleaning or any procedure that may be done. I had mentioned earlier that you want to purchase ice bags and keep them in the freezer before you come to this for your surgery. Other things you might want to think about so you don't have to do it afterwards, after your surgery, is to have like a multivitamin, to have a bowel softener, and just make sure your pathways are all lit up clearly so you can see in the middle of the night. We find that people get up to go to the bathroom quite often. And we just want to make sure that you're safe. Also, your pathways, make sure they're free from, like throw rugs. And then the other thing that I want to make sure that you're aware of is that if you come to the hospital, you can bring comfortable clothes with you. Some people don't like our gowns and may want just comfortable shorts or elastic band, sweatpants, slippers that have a good sole, a shirt. That's all fine, whatever you feel comfortable in wearing. And then you can bring your laptop, your tablet, books. I can't guarantee you're going to have a lot of time to do those because we do keep you busy and keep you active. But you can bring those. If you have a BiPAP or CPAP, you'll want to bring your tubing and that along with you. You are, at this point, able to bring inhalers or eye drops. We'll relabel them in the pharmacy, but you can utilize those on our floor. All the other medications you can leave at home. Our pharmacy takes care of the medications for you while you're here, unless you've had an organ transplant or are on special medications, maybe for cancer. You can talk to your doctor about that or us when you come, but you can bring those medications and we'll relabel those in our pharmacy also. Well, I thank you for choosing Mercy Medical Center, and I look forward to taking care of you.